Hi, I'm Kathy,
And I'm Casey,
and we're with CNC Senior Living Advisors. Thank you for joining us for our first podcast today. We're going to talk a little bit about how we got started in our business, and then Paul from Gentle Turns is going to talk a little bit about his business. My sister Casey here will tell you a little bit about her background.
Hello, I am a registered nurse for 20 years and have been in senior living for over 30 years in different capacities, from owning my own assisted living home to being a wellness director in different parts of Arizona, being a director of nursing, a discharge planner at hospitals. So we also owned a hospice together. We had it for about 4 years. And so then Kathy can tell you how she got started in senior living from there.
Well, interesting enough, I was working with special needs kids at one of the local high schools, and my sister brought up the idea of starting a hospice because she worked in a hospice and thought she could do it better and more ethically. And so even though I didn't know what hospice was, I jumped in and I learned all about the wonderful benefits of hospice and working with seniors is how I got started. And then I ended up, after we sold our hospice, working in a senior living community as a sales director. I've worked in a few sales positions in different communities and was promoted to executive director in one of those positions. So learning both sides of how it works, and then having her background with wellness and doing assessments and things with those clients, we decided to take our combined experiences and start our own placement agency, hoping to just serve the great senior population and do things. Even if we don't have a placement, we want to be a referral source and help them. So we started our preferred vendor list. And that's why Paul's here. We are working with people that we know, like, and trust in the industry that provide services to our wonderful seniors. And again, if we get a lead and it's not a placement, but they need help getting to the doctors or for different reasons, we are going to partner with these people that we are introducing you to. So that leads us to Paul here. So Paul, you want to tell everybody a little bit about yourself and how you got started in this industry?
Sure. Hi, thanks, Kathy. I'm Paul Minch. Gentle Turns Transportation is my company, and I've been in healthcare for over 35 years, long time, but mostly doing administrative work, working for large payers, HMOs, healthcare companies. Anyway, as I got later in my career, I just decided I wanted to be more face-to-face and helping people face-to-face. And so I was working with a transportation company and decided I think that I could start it off here in Phoenix, in understanding the need in the senior community here and how much the Phoenix market is growing. Just decided to get started with providing transportation for seniors to their doctor's appointments. And so as we go today, we'll tell you a little bit more about that.
Great. Well, thank you for making that leap and starting your own business. And we're in the same boat. Our business is fairly new, so we're just hoping to get out there and help you get leads and help us, and we partner together. So oftentimes when we have a placement, they might be coming from a rehab or the hospital and need a ride to the community, and that's when we would reach out to Paul or have our client reach out to Paul and have them, because he tell them about your
Sure.
vehicle and what it can accommodate.
You bet. So we have vehicles with ramps, and most of our transportation is for folks that are in wheelchairs. We can also do stretcher transport. So if someone is discharging, as you say, from a rehab facility or from a hospital and they need a stretcher transport, we can accommodate that as well. We have 3 vehicles. What we do is a little bit of a white glove service. We bring people into the vehicle. We can secure the wheelchair to the floor of the vehicle. We put a seatbelt on them, make sure that the transportation is safe and secure. We take them to their doctor's appointment. We actually take them inside and get them checked in, make sure that they're all ready to go. And then I just hand them my card and say, call me when you're done.
Okay.
My number 1 goal in this is safety. And number 2 is the fact that I don't want them to wait, because we all hear stories about how long people have to wait for transportation.
Okay.
And so I don't want them waiting more than 15 minutes.
Okay, that's great. And do you accommodate if they have a family member, somebody that's coming, a caregiver that comes with them?
Yes.
Okay.
Yeah. In fact, all of our vehicles, we have seats where a caregiver and or a family member could ride along.
Okay.
that really makes the big difference, Casey, as you know, because many of our patients or our clients have dementia or they're just unsure and uncertain about what's happening, and so having a family member along makes a big difference.
And then what areas do you cover?
So we cover the whole Phoenix Valley.
Okay.
We have clients as far away as Maricopa and Gold Canyon, Sun City West,
Wow.
and Peoria. So we literally cover the whole valley.
Okay, and do you charge per mile? Okay.
Yeah, so our base rate includes up to 10 miles.
Okay.
And we have a rate for folks that are ambulatory or they can just walk back and forth. And then we also have a wheelchair rate. Base rate includes up to 10 miles. That's $90 for a wheelchair. It's $70 for ambulatory.
Okay.
And then for round trip, we always discount the return ride. And so for wheelchair, it's $150, and for ambulatory, it's $120.
Great. And let me ask you this. We're starting off in our business. What sets you apart from other transport companies?
Yeah, good question, Kathy, and thanks for asking. I think it really is the experience that I have in healthcare, knowing how important it is, these types of services that are just absolutely critical for people getting to their healthcare. Transportation really is a barrier to care. So I've spent a lot of time through my years understanding that, knowing that, and trying to help that from the distance. Now I get to help face-to-face doing that. And my goal, again, is safety, low wait time, but also just showing the respect and care for the senior population, which in general, I think as our society, we really don't spend a lot of time respecting the senior population. And so that's really important to me. It's a difference. I get to know all of our clients. I'm driving myself, so I get to know them. I get to know their stories, and I love just hearing what their what their background is and all that.
I'm sure that means a lot to them. They don't always have somebody to share stories with or talk to throughout their day.
That's very true.
And you build that relationship so you can continue to take them to different doctor's appointments. Whereas I'm sure it's fair to say that your prices are a little more than an Uber or Lyft, but they're not getting the same service from
You're
them,
right.
and they're not building that relationship, and they can't always accommodate the seniors
right.
either, or don't know how to relate to them.
No, you're exactly right. And when people ask if I'm comparable to Uber and Lyft, I really am not. I'm not trying to be, just because it is a different service. And I have clients over this past weekend. I took clients, husband and wife. They wanted to go to a wedding, and so she's in a wheelchair. So I transported them to the wedding, and I came back 5 hours later, and I took them home.
Oh,
It's just things like that. So it's designed around medical appointments, but it's really not. I don't stop there. It becomes a relationship. And whatever they need, some folks, if they need to go to CVS or Walgreens, or they need to pick up a prescription along the way, we'll do that.
So I'm guessing it's privately paid. There isn't like an insurance that would
Yeah,
cover
another
that.
good question, Casey. Most insurance companies don't cover this, sadly. There is coverage through Medicaid, the low-income population. Medicare, straight Medicare does not cover it. Some Medicare Advantage plans will add that benefit, but what I have discovered is that mostly those benefits have been cut back by Medicare Advantage plans, and if they have it, there's a large copay attached to it. So yes, most of it is private pay. And we work with people if they have limited funds, and we work with them on that as well. And we offer a military discount.
Oh, wonderful.
Oh.
That's great. And how do you accept payment? Would it be...
Yeah, we'll accept a personal check.
Okay.
We'll accept Zelle. We do credit cards. But we have to add a 3.5% fee for that because they charge us for that. So.
Okay. And if how much notice do they need to give you?
Yeah. We ask for 48-hour notice because if we have that much time, then we can typically work our schedule to make it happen. But if we have availability, we'll go same day. So it just depends on our availability. It's getting to the point where 48 hours is really helpful just because the schedule gets tight after a while.
And if they need to cancel, is there any kind of charge for that?
No cancellation fee.
Okay.
No, we understand things happen, things change with the doctor's appointments, and I had somebody cancel just because they weren't feeling well and they couldn't go. They can't control that. So yeah, we don't charge a cancellation fee.
Okay. And for our viewers watching, what is a good lead for you?
Yeah, a good lead is anyone who primarily in assisted living, mostly at the group home level, because the large assisted living centers usually have their own transportation. Although I will act as a backup for those, and I have done that. But mostly it's around the group homes where they're between 5 and 10 residents. They don't have a defined transportation solution, so someone who's in that setting needs a ride to and from the doctor's appointment or cancer treatment, dialysis, whatever it is they need, that's a really good lead for us.
So you can go on Saturdays. I know sometimes they have a Tuesday, Thursday, Saturday
Yeah.
dialysis. And
You're right, that's common, and we do rides all the time on Saturdays.
Oh, great.
Yep.
That's
In
good.
fact, we'll do rides on Sunday too. Try to avoid Sunday morning, but for the most part, we'll do rides anytime.
Okay, that's great
That's
to
great.
know.
And it's useful for us as placement agents if we are accepting or assisting somebody to be, once they're discharged from a rehab or hospital, oftentimes there isn't that transportation. So you would be a great referral source for us. You are a great
Great.
referral source for us. And are you able to accommodate oxygen?
I can, if someone has oxygen and they're bringing it along, certainly I can secure that, no problem at all. I typically don't provide the oxygen, but if it's there and they need to have it along with the transport, that's no problem at all.
Okay.
Yeah.
And do you do any kind of screening? So if somebody's leaving a hospital, they have some sort of respiratory illness, would that be an issue? Do you ask
Yeah,
questions?
we typically ask questions
Okay.
like that to just understand what their basic needs are. And, I try not to get too deep into the personal health information. However, what I'm looking for, just any information that I need to provide a safe transportation.
Okay.
So it's safe for them and also safe for our drivers.
Okay. Is there a situation where you would have to decline somebody's request?
I'm sure there is. I haven't run into that yet.
Okay.
We've been able to accommodate everything so far. But yeah, the one time that I did turn down a ride was when their mother was in the hospital. They said, "Oh, I think they're going to get discharged tonight." This was at 8 p.m. We were talking, and they said, "I think that's still going to happen tonight." Well, I don't ask our drivers to go out at such a late time when it's so uncertain.
Right.
If there's a defined time, we know we can do that, that's great. But when we all know discharge from hospital can be iffy. So we didn't end up doing that ride. In fact, that person did not end up getting discharged that night either. So we did the ride the next day.
Right.
Yeah, and we have developed relationships with skilled nursing facilities, post-acute, some hospitals. So we're really looking to expand those relationships in any way that we can, and look forward to being able to provide and love being able to support both of you and doing what you're doing.
When we've had the opportunity to meet with Paul several times and got to know him, and we want to do business with people that are like-minded and really want to serve our wonderful senior population with honor and dignity and compassion and we feel that Paul has those characteristics as we do, and it's very important to us, and we want to just be a team with all of our referral partners, and so we hope to have other people join us for a podcast, and Paul in turn has gotten to know some of the same people. We're in the same circle, so our ultimate goal is to always do the right thing for the seniors, and
It's great to network with other people that are so passionate about providing this care for the senior population, right?
Yes.
And I always say it's kind of a mix here because this Phoenix area is growing so much, right? It continues to grow. And then we also have this population that's moving into the senior age level. So the need is great, and there's a lot of these services and the aspect of just aging into that population that are necessary. It's a great environment, and I always love to say too, it's great to live here because the medical, all of the physicians and the specialists and the hospitals, it's a great market for all of that because they're supporting the senior population.
Absolutely. Yeah.
yeah. Well, we are excited to have you. Thank you. And stay tuned for more of our videos. And again, we just want to be a resource. So we will leave our contact information. So if you have questions about anything,
And Paul's contact
And Paul's.
information.
anything to do with seniors at all, whether it's placement or not, we want to help. So it could be in-home care, you need a hospice referral, home health.
And speaking of veterans, if they need assistance with their aid and attendance, or if they don't even know that they have that benefit, we have resources for that as well. Working with Arizona Long-Term Care, we talked about Medicaid, seeing if they have that benefit that would be useful to help pay for transportation. So there's all kinds of things that we can help with.
We have partnerships with adult daycares too. So again, we will leave our contact information, and we thank you for joining us today for our first podcast. And thank you again,
Thank
Paul.
you, Kathy and Casey.
All right.
All right.
Thanks, everyone.
Thank you.
Bye.